pleasure for me to have Sara Escobar here tonight to speak to us. Sara has been in social justice work for 25 years and is currently a member of the Waterloo Region Drug Action Team. Is a new growing developing organization in Waterloo Region. As co-founder of Peregrine Outreach Waterloo Region, a network of care for the street-involved population and workers that support them. She has also worked for numerous local agencies such as OneROOF, the Working Center, House of Friendship, the Cambridge Food Bank, and most recently at Porch Light Counselling. Through many years of supporting members of our community, she has witnessed how current decision-making practices and policies, when implemented without input from those with lived experience, cause harm to everyone in the community, not just those who use drugs. And Sara, you and I have had several conversations. I've learned a ton from you in a short period of time. And I'm glad that you're here tonight to share some of your thoughts with the community here on the virtual town hall. So I'll turn it over to you right now.
Thanks for offering this conversation and allowing us to have this platform so we can share the knowledge that we've accumulated. So the first thing I want to do is I actually just want to take a deep breath and acknowledge that this conversation is beyond difficult. Beyond difficult because we've had people in this call who have had experiences with death really close up, if not next to them. People that we've worked with, people that we've loved, people that we've connected to, and people we've had relationships with. And so I'm going to take a deep breath. And I'm just going to take a second to acknowledge that that is real, that the numbers that the folks that have spoken before me have named, the data is, there's real people behind all of those numbers. And now we're going to talk a little bit about the folks that are supporting our loved community members who are struggling and through that pain, whatever that pain may look like, they're self-medicating, and because they're searching for that soothe and that medication, they're now being put at risk with some intentional drug poisonings. So we're going to get into that. So I'm going to read a quote, and this is this has come in a few different times in the conversations that we've been able to have with frontline workers. Quote is very simple: "We aren't burned out. We are heartbroken and angry." We aren't burned out. We are heartbroken and angry. Those are real words from real people. And we can't dismiss them. And I know our intentions are not to be dismissive, but if we listen to how we've been, and we pay attention to how we've been responding to this crisis, both to the people who are directly affected and those around us, we are being dismissive. I'm going to come back to that quote as I go through my little talk here. So today I want to be able to come from a perspective of two simple assumptions. People's behaviors make sense. People's behaviors make sense. There are reasons why people are doing what they're doing. They are self-soothing, they are taking care of themselves, they are providing safety where safety is not being provided for them. And the second one is just that, is people seek safety. So we're going to talk about those two things. Solidarity is messy, and we have to be able to talk about solidarity without making it an F word, without making it a curse word. Solidarity, when people come together, when people connect, when people are able to communicate and talk, when we talk about definitions, our intentions, it's not just good intentions, but in fact, we know why certain things, we're doing certain things, and what is it that drives us. We need to be able to know that as a community as a whole, we need to know what our intentions are. The work we've been doing so far has gotten us where we are now. The conversations that frontline workers have entrusted to politicians and decision makers, they're good intended, well-intended conversations. We want to be able to all have a sit down, come up with solutions. We don't want people in pain. We don't want people suffering. We don't want people living out on the streets. We definitely don't want people dying. The pattern that we're seeing in the front lines and what we're hearing from folks on this that are doing this work, that are connecting and loving our community, is that politicians sit with us, decision makers sit with us, funders sit with us, and they listen, and they get eager, they get excited. We're so thirsty and hungry for a solution. But what we do is we listen and we plan out a 10-item list, 10-item plan. And people get really excited and say, oh my gosh, Sarah, that's so great. That's so good. Let's go. Let's do this. But you know what? We can do it quicker and we can do it cheaper. Let's do that. Let's do that version. So then we say, oh, okay, well, it's better than nothing. It's better than nothing. Now we have to sit and admit that when we start to say it's better than nothing, we are admitting we're leaving gaps. We are admitting that there's going to be policies and procedures that we've just sit down and written that are going to cause harm. We've intentionally left those in. Now we're getting into the space of necropolitics. And necropolitics is decisions, policies, laws that intentionally will cause harm to relief and cause comfort for others. That's what that is. And we're doing that. We're doing that all over the place. And we're doing it in the name of frugal budgets and the name of speedy timelines. Because in our world, time is money. And so we got to make things quick. Frontline workers can't go fast and quick anymore, or cheap and quick anymore. The workers right now are seeing the results of years of decision making where we have been asked to do things and do the work for less. And this is where we've ended up. We've ended up in a place where we are asked to leave little bits of ourselves behind, right? Because there isn't enough time to go do everything. And there isn't enough money to go do everything. And so what you're asked to do is, you got to go do that one thing up there. And so what you do is, okay, hold on a second, because I can't bring this piece of me to that. That's what my job is telling me. I can't involve this. So I'm going to put this little bit of myself here, and I'm going to move forward. You move forward, and when you're done that, you look back, you got to go gather yourself. But there's no time because the next crisis is occurring. And there isn't enough staff to be able to deal with all of that stuff. So you know what? It's okay. You're gonna wait to go gather yourself. But for this other thing, you got to put another piece of yourself aside. So you go again. This happens over and over and over again. By the time we look back, we ourselves are so far behind, and there is no time to go back and gather ourselves. We're leading with love. We're doing the work. We're sacrificing. We're taking risks. And none of it is being written into policies. None of it is actually being acknowledged. A lot of the work that happens on the ground from frontline workers are driven by ethics and values and morals. And a lot of it, policy and procedures, doesn't have room for those ethics, values, and morals that drive the human spirit to connect with one another, which is what frontline workers are doing out there. We know you're connecting. We know you're building real relationships. We know you're loving the people that are out there that you're supporting, which means that the pain will be that great when death occurs. When we see our loved ones, our friends, our community members struggling and dying, that is real pain. That is real struggle. That is real grief. And we're not addressing that grief. And the reality of just being able to sit and acknowledge where we're starting from without criticism, without being too critical of one another, but just to truly be able to acknowledge that right now we are all tired, and that's okay. We're all hurting, and that's okay. The heartbroken is real. We're human, and we drive and we live with human spirit. And so it's okay to be tired. It's okay to be heartbroken. It's okay to want to connect. We need all of that. We need to be able to give time and room for each other to listen. This is huge. This is so big, and people are tired. And so if we have heads of agencies right now, if you have a team that you lead, if you're a decision maker and a funder, 2 things you can do. Please write into your policy and procedures time for your frontline workers to take care of themselves, for briefs and debriefs, for them to go do things on their own. Write in extra mental health days that people don't need to write a resume for, so that they can hand it into HR and then be approved. Trust. Figure out what that means to you and your agency and your staff to trust each other. We are short-staffed, and the people that are coming to work are exhausted and heartbroken. We need to be able to start taking care of ourselves in a different way and addressing the human spirit that really, really leads us, and that is who we are. What's the time? I lose track of time.
I'm just sort of, I'm losing myself in what you're talking about, because it's just bringing me right in.
So, and spiritual pain is one of these things. So we talked about burnout, and burnout is real. We can define burnout, but I want to talk about spiritual pain. And I think that people can connect a little bit more. And this language comes from Vicki Reynolds. If you've never read Vicki Reynolds and you don't know who that is, please tell your managers, your supervisors, the EDs. Vicki Reynolds. She was able to give us language that we could connect with, that made sense. It sounded different, and it came from a different experience. And so spiritual pain just means, like I said before, every time you sacrifice and you leave a little bit of yourself behind so that you can go and do what your policy and procedures are asking you to do, that causes spiritual pain. The burnout is not from how difficult the people that we love are, or the difficult behaviors that they bring to us. That spiritual pain really comes in from the social structures and the policies and the government structures that don't allow us to truly connect with those folks that we are loving and supporting out in our community. Sorry, I've lost track of my stuff here, so give me 1 second. The other piece I wanted to talk to you about is just trauma is real, trauma is there, and we're all supporting folks who have had real pain. But it's not always about trauma, and it's not always about depression. It's about oppression. The system we live in is oppressive. It's not enough that we are going to do little bits, that we're going to help out. We have to change the system that is creating that oppression. We do not want to just help people get and normalize the oppression that they're existing in. We don't want to ease that oppression. We want to eliminate the oppression. And those frontline workers out there, we are not burned out. We are heartbroken and we are angry because we see the larger system.
Yeah.
And that's what hurts.
Yeah. And I think, Sarah, my mind's blown a bit. I'm just, because you're providing a context that takes a look at the larger picture of what we're talking about here. People see people struggling with addiction, but we forget about all those that are helping support those people and the struggles that they go through. Because if we lose the support people like yourself, who are the frontline warriors in this fight, then we have a real problem in terms of we can't help at all then if we don't have people at the front line. And we have to think about taking care of those people. So I don't want to say it's like, you take your car in for a tune-up and this and that and the other thing, but we got to recognize people are finite in their abilities and in what they can do, and we have to make sure that their ability to keep doing more, we're protecting that, we're caring for that, and we're finding ways, like you say, to provide that mental health break or assistance or what have you for our frontline workers too. So
folks that got into this work, you came in to work at a shelter to see people thrive, get better, leave, go out and live their life. Drop-in centers, outreach workers. We came in to watch people change and improve and do other things to live.
Yeah.
Nobody came in to do this work, to start burying people and to actually experience death.
Right.
We are not prepared for that. Nobody
No.
is prepared for that.
No. And you know, we can develop all the programs we want or build all the buildings or encampments we want, but if we don't have people there to help run those things, to operate those things, to reach out to the people that we're trying to help, then we have a problem. Then we can't do what we want to do.
Yeah, and the other big thing for me is we know that the higher ups are doing what they can. We know everybody's working and writing reports and looking at the data and applying for funding. We know that. Unfortunately, it doesn't change our experience of heartbreak and heartache on the ground. And we need to be validated in that is real. And that it's okay that things are changing and people are working above, but down here, it's hard and it's real right now. Right now, it sucks.
And Sarah, I want to thank you for this presentation, but also on a personal note, the other times that we've gotten together, because you've educated me a lot through this journey. And I know there's there's more in future discussions that we'll have that I will be able to learn from. So listen, I thank you very much for sharing with myself and everyone else here this evening.